Okay, we've got assisting with use of a bedpan. And first I'll demonstrate if a patient was able to help lift his bottom up. So come into the room, I perform hand hygiene, come into the room, identify the patient, put on my gloves, explain to patient what's going to happen, that I'm going to have him or I'm going to lower his head, have him or her bend their knees and push their hips up while I place my hand under their sacrum to help with that. And as that happens, I'm going to slide the bedpan under them, and I will cover them back up to provide privacy. Lift their head back up to a comfortable position. Make sure that they're comfortable. Hand them the call light and answer it as soon as they push, or as soon as I can when they push on it. So when they push their call light, I come back in. I ask them if they were able to perform perineal care by themselves. This particular patient said no, so I'm going to help him or her with it. So I perform hand hygiene, put my gloves on, get some toilet paper or a bath light, pull the blanket back up, help the patient with their care, and I'm going to put the soiled tissue in the bedpan. Okay, then we're going to do the same thing again, have them bend their knees, lift up their hips while I help. Actually, first I would lower their bed to make this part easier. Bend their knees, push up their hips, remove the bedpan, set it on my chair over here that's protected with the pad. Provide privacy by pulling this back down. Provide comfort by putting their head back up. Make sure that the patient's comfortable and hand them the call light. Oh no, I would give them whatever they needed to do their hand hygiene. And I would again perform hand hygiene. Take my gloves off and I would throw them in with the tissue. Perform hand hygiene, ask them if they're comfortable, if there's anything else that they need, and make sure that they can reach the call light. Now, for a patient who can't lift their hips, same process, hand hygiene, identifiers, provide privacy, and glove up. And at this point, I'll let them know what's going to happen. I'm going to ask them to roll away from me. That way, actually, I'm going to lower the bed first, then ask them to roll away from me. And at that point, I will slip the bedpan. I don't know if you can see this. Slip the bedpan under them. And I'm also going to slip a roll underneath them to kind of support their back while they're on the bedpan. Then ask them to roll back over on their back, lift their head back up, and then also lift their knees up or provide some kind of support for their knees. Make sure that the patient is comfortable, and I will perform hand hygiene again. And hand the patient the call light and answer promptly whenever they press it. So the patient's on the call light now, and I come back in, hand hygiene, glove up, make sure I have all my things together in case they need help with perineal care. And at this point, I would lower the head of the bed, ask the patient to roll away from me, perform perineal care, remove bedpan, set it on my pad, remove the roll, set it on my pad, then roll patient back over, lift the head back up, make sure the knees are in a comfortable position, and then ask the patient if they're comfortable, if there's anything that they need. Make sure that they have the call light. Perform hand high action. Well, I wouldn't have taken my gloves off yet. I would clean out the basin. So I'm going to go dump all of this in their toilet, and then I'm going to spray this out and disinfect, put some disinfecting spray in it if needed. I mean, or not if needed, if whatever our company tells us to do per company policy. And store it for later use. My linens, I would gather up, not touching myself, and put them in the dirty laundry basket. And come perform hand hygiene. Ask the patient if he or she needs some hand sanitizing gel, or provide the patient some. Ask the patient if they're comfortable again. Make sure they have that call light. And that's what I would do.